listening to the best of the Martha Zoller Show. To hear the full show each day, tune in to AM 550 and FM 102.9 WDUN or log in to accesswdun.com and click the Listen Live button from 9 to 11, Monday through Friday. Joining me right now is Anne-Marie Beurkle. She's a former congresswoman, a former nurse, former Consumer Product Safety Commission chairwoman, and she asked an important question. Why is there no healthcare agenda for any of the GOP hopefuls? And I would say, Anne-Marie, first of all, welcome to the program. It's so great to have you. We spend about half of the money in the federal government on healthcare programs, probably more than that. You probably know the number. And nobody's talking about it.
Good morning, Martha.
Good morning.
Thanks so much for having me. Yeah, it's really disappointing, both personally and politically, that the Republicans just don't have a health care agenda. And I'll say worse than that, they're following the lead of Bernie Sanders, who's the chairman of the Health Committee in the Senate. And so he's coming up with his socialist ideas, and they're, pretty much lock and step with him, which is a huge mistake. They have an opportunity here to really address what's on the minds of the American people, and that is the cost of health care, the availability of health care, and making sure, they have access to it. And they're just failing. I think it's a big mistake politically.
So why do you think they're doing this?
Well, okay.
Or not doing it, I guess I should say.
I mean, it's what's going on in this country right now. There's a lot to think about: inflation, immigration, crime, drug overdoses. There's no budget for 2024. There's so many things to be thinking about. But healthcare is an issue that's just as important as those other issues. It's just not as, I'll say, sexy and apparent as those issues are. But Republicans have got to focus on what's important to the American people. 54% of the Republicans in this country say health care is their primary issue. They've got other issues, immigration, inflation, and so many other things, but they are concerned that health care continues to get more expensive and the availability of health care is becoming an issue. The Senate and Chuck Schumer is focusing on putting together a health care bill, and it would be one bill with several smaller bills within it that address health care, all led by Bernie Sanders. One of them is to get rid of or weaken what's known as a PBM, a pharmacy benefit manager, which if you have a health care plan, more likely than not, you have a PBM, and that entity negotiates with drug companies to get drug prices down for your health care plan. To weaken those or to get the FTC involved, which is what this bill proposes, is a huge mistake. Every Republican should stand against it. And they're not. They're not looking at health care for free market approaches, for free market solutions. They're just following along with Bernie Sanders. And that's, I think, politically wrong.
So, obviously after ACA, it is true that more people are insured. That is true. But the cost is about twice what it was in just that short period of time. I'm having my knee replaced on Thursday. Okay. I am 64 years old. I'm a small business owner. So, we have a small group. And I'm going to get, I've got pretty good coverage. Okay. But I'm still going to, I am paying a much higher premium than I was. In fact, I jokingly say it's a good thing my house is paid off because I pay a very large healthcare premium in my age group for this because it's a small group. And then every year, it almost seems like the company that was doing our small group coverage for the nurse, my husband and I have a correctional nursing business. The company goes out, they stop doing small groups, and then you've got to find another company to do it. And that's a common problem that small businesses are having. So what is it going to take to get Republican and Democrat candidates more focused on this in a real way?
Well, I think it's the Republican leadership who needs to acknowledge that this is an issue and that the American people are concerned about it. And again, there's so many things they could be doing. They could be modernizing and overhauling the FDA, which has archaic, approval processes that take so long. They could be, I'm sure you've seen in your area, confronting a hospital monopoly. So many small hospitals have merged into these huge systems. That needs to be looked at. There's a lot of dishonest billing, and that drives up costs, dishonest billing going on with these healthcare conglomerates. And so the Republicans need to stand up and say, in 2010, and quite frankly, they weren't successful, but they addressed and they told the American people they would begin to address the Affordable Care Act that you just referred to, and that they would repeal and replace it. And in that Congress, they won 63 seats, a Republican majority in the House. So it's on the minds of the American people. The Republican leadership has to acknowledge that, and then they have to give some concrete examples of how they're going to move forward with a health care plan. And I politically, and I'll say personally, I'm a nurse. I've spent my whole life in one way, shape, or form related to health care. I had elderly parents. I had a handicapped sister. Health care affects everyone. Health care is something that really you can't get away from it. Whether you're healthy or you're sick, you're talking about a knee replacement. And for small businesses, it's very troubling because the small businesses, so for instance, the Senate last week has been, over the past several weeks, has been talking about capping insulin prices, which sounds so great. But they're only capping the price at what the consumer will pay at the pharmacy. They're not going back further to say, no, we've got to cap what a drug manufacturer can charge for their insulin. That's how you're going to cut costs. You cannot just say, okay, well, we're going to limit what the patient pays at the pharmacy to $30. But on the back end, the drug manufacturer can charge whatever he wants. There are things that they can do, and I would say to the Republicans, because I want them to win the majority, I want them to stay in control of the House and gain the Senate. But
the insulin situation makes me so mad because if you know the history of how that came about, how that patent came about, how all that happened, it shouldn't be expensive. It really shouldn't be. But, it is what it is. And
it is what it is.
And
right.
It is $1 of every 4 in healthcare spent on some kind of diabetes management. And so, it's a big problem that we have. And look, I'm a free market person on healthcare. My husband was a solo primary care physician, so he was a dinosaur. He did his whole practice until 5 years ago as a solo practitioner, and now he's the doctor at our detention center here in Hall County. So, and it's really a pleasant job because there's no insurance. you get paid at the first of the month, and that's great, But there is such a challenge, and I think during COVID, some people saw that maybe there ought to be a basic level of care that's available. But the challenge is you can't negotiate with Democrats on that because they want to include everything as being basic. I think there's a mood in this country, and I could be wrong, you've got more data than I do, that some sort of basic care being covered, I think most people could support. But it's what is the definition of basic?
You're absolutely right. I think that, and there certainly is an interest and an appetite in the American people to know that when they need a primary care physician, there's going to be one. But that's one of the things the Affordable Care Act did. It promised all this care, but then it doesn't help. If you're a primary care physician, family physician, pediatrician, psychiatry, those non-specialty, I'll call them, areas, the reimbursements and the way doctors get paid, it's unsustainable. If you have a $500,000 debt coming out of medical school and then you go into one of those practices, so everyone becomes specialized.
Well, I can tell you that if I had known our best year was going to be 1998 as far as payments were concerned, and it's not that we've done poorly. We've had a great life related to my husband's primary care practice. It's wonderful, but it was a challenge. It was a real management kind of thing because the reimbursements started going down. And you had to see more and more and more people to make it viable. And, and the biggest lie we tell people is that, if you don't have insurance, you can't see a doctor, because a lot of my husband we always had payment plans for people. We never turned anybody away that was sick that needed a doctor. We never did that. And I think most doctors would not do that. But now that most doctors work for big medical groups, it makes it harder for them to have those kind of policies.
So that's so true. That now that they're working for hospital systems rather than private practices, they lose that kind of control, and that, where they can have that kind of discretion. And again, that's a problem, because hospital systems, if you go in to see your doctor who's a member of one of those conglomerates and not on his own, what they're doing, and there's legislation that's being introduced to address this, they're billing the patient at the hospital rate rather than the physician rate, which is much higher, which is a big problem, which is driving up the cost of health care. There's many things the Republicans can do. I'll give you another example, because you raised the issue of insulin, and Mike Lee has a bill introduced, but the introduction of biosimilars and the ability to get those approved more quickly. If a drug can address the issue and is the same as the name brand drug, they should be approved after appropriate amount of testing and review. But that's, again, you get competition, you get and you don't get the protection, and the pharmaceuticals aren't protected with their name brand, and those biosimilars can be very effective in reducing the cost of drugs. Again, so many things the Republicans could do if they didn't follow the lead of an avowed socialist, Bernie Sanders, if they understood how concerned the American people are about it, and how if they understood the issues. Again, I'll go back to PBMs and the pharmacy benefit managers. That program and those entities save each patient in this country $1,000 a year in drug costs. They're the only entity on that drug supply chain that are financially interested in reducing the cost of drugs.
Anne-Marie,
to get rid of them.
Anne-Marie Beurkle, people want to know more information. How can they get it?
I have a Twitter account, and I will send that to you, Martha, and maybe you could post it on your, it's just at AM Beurkle, but I can send that to you so you have that.
Great.
My Twitter handle. And really appreciate the opportunity to talk with you this morning, and I hope your knee surgery on Thursday goes extremely well.
I think it will.
Good recovery.
Yeah, it's all about the rehab. Anyway,
exactly right.
That's right. Thanks so much for being with us today.
Thanks for having me. Thank you, Martha.
It's where North Georgia comes to talk. It's the Martha Zoller Show on AM 550 and FM 102.9 WDUN.
One of the people that were not on the stage last night was Larry Elder, who is a radio talk show host, but he also ran for governor of California. But his whole message is about fathers and fatherhood. And I've talked to Meg Meeker a number of times, Dr. Meg Meeker, a number of times over the years on the books she's written on parenting. But she had a new thing out that was turned into a movie, and it's called Strong Fathers, Strong Daughters. And the movie is on Great American Family, and it was fantastic. And I've watched it. It was great. Meg, welcome back to the program. It's great to have you here.
Oh, thanks so much for having me, Martha.
Whether you're talking about fathers, which is what you talk about, or this whole kind of phenomenon that's happening around this folk singer, Oliver Anthony, that's talking about men being underestimated. Basically, the whole message is that, you're kind of throwing men out. We have this society that has been telling men that they don't have to be a good father. They don't have to be a good provider, and that somehow that traditional role is not a good one.
Mm-hmm. As a pediatrician, I'm a kid advocate, and I've taken care of thousands of kids and listened to them talk about their dads, whether their dads are at home with them, whether their dads have abandoned them, whether they've never met their dad. And I can tell you that universally, kids say, I want my dad. I need my dad. A good dad doesn't have to have a PhD in psychology to connect with his kids. Kids want their fathers with them. They ache for it. And, unfortunately, our culture is controlling the narrative of my patients' fathers and how they perceive themselves. And we have, because of political correctness or our own agendas, as adults, we have pushed fathers out of the way. We've thrown them into orbit. This is killing our kids. We have so much research that shows that girls and boys who have a father in the home, they are less likely to be depressed, anxious, eating disorders. They graduate from high school. They go on to college and graduate school. It's absolutely irrefutable that a child with a father at home does better across the board. And we're at a point where we have a crisis of mental health among our teenagers. We have depression and anxiety going through the roof. And what I see as a huge part of the answer is dads being engaged in the home. So we as adults got to get over our bias about, that anybody can raise a child as long as they're loved, and say, look, this is what our kids need to get healthy mental health back, and it's their dads. And I'm just amazed that more people aren't speaking up on behalf of kids.
We're talking to Dr. Meg Meeker, and the movie is called Strong Fathers, Strong Daughters, and it premiered on Great American Media on August 21st, and it's currently streaming on PureFlix. It's a story. This is a regular movie. It's kind of a Hallmark style movie, if I can use that. But it tells the story of what you're trying to say about fathers.
Absolutely. It's a great movie. It's a feel-good movie. But the point of the movie is that a good dad makes an enormous difference in a daughter's life. And not just, his oldest daughter, but his middle daughter as well. And it shows the power of a decent, normal, good guy dad. I mean, this guy is just an invested dad who wants to do well by his daughter, but he's taking her in the wrong direction. And he's corrected and said, no, you really need to understand what's going on with your daughter here. I love the movie. I will tell you, I've seen it 4 or 5 times. At the end of the movie, I always cry, that yellow balloon.
I love a good movie. I love a good movie that makes me cry. Rod Huey's here with me today. Yeah. Rod Huey's here with me today, Pastor Rod Huey, and I know in the work you do in your church that this role of families and in your own life, I mean, you're the father of children and grandchildren and all of that. How important has that message been, and how have you seen it under assault over the years?
It is so important. I am so excited to hear what she's saying, because you're right. You're absolutely right. There's a power of the dad. And what happens is so many men feel like they have to be perfect that they run away from from being a father, not realizing being a provider sometimes is all they need. Provide love, provide, that energy, provide that security. And you go, well, what about the money? Do the best that you can. It's, being a great father doesn't mean you got to have all the money, but it means you got to be willing, to do what you have to do to provide.
You're absolutely right. And I can tell you firsthand, I've been at this for 34 years and listened to these kids. Kids don't care about the money. When I ask kids, what do you love about your dad? What do you like about your dad? They say this: he's fun to be with. He listens to me. He takes me fishing. He taught me to change the oil in my car, maybe from a 10-year-old girl. They never mention the size of their house. They never mention dad's job. They never mention whether they're wealthy or poor. Kids are born to connect with people they love. And if they don't have that deep connection, nothing else in life matters. And we don't focus on that. We focus on all the externals. And I just feel very, very strongly that rather than criticizing men for never being around and, and being gone and, they're bad people because they've never shown up for their kids, look, let's turn it around. Let's say, you guys, you can do this. I've had kids in my office who are dying to see their dad who's in prison, but whose mom says, no, he's a bad example for you. But the kid said, but he's my dad. Can't I just see him? You see, kids are connected to their dads. And even if the dad has made a lot of mistakes, the kid has the ability to look at that dad and see the goodness in there that they need. We need to be strong enough to allow them to have that.
Dr. Meg Meeker, if people want more information, how can they get it?
Go to meekerparenting.com, and help me champion our dads. We need strong voices out there to speak on behalf of our kids, because we're in trouble with our kids, and having dads engaged is an enormous part of the answer. It's so simple.
Putting the talk in news talk. It's the Martha Zoller Show on AM 550 and FM 102.9 WDUN.
Joining me right now is Matt Brown. Finally, after all of these weeks of talking about all of this, we had the piece de resistance yesterday when the former president goes in and gets a mugshot. And really, it's like the mugshot heard around the world, Matt.
Yeah, after so many weeks and months of discussing this, figuring out what the charges were going to be and everything, we finally have now seen Trump actually go down to Rice Street and, see his, have his mugshot taken, have his inventory taken, just like any other, indicted person in Fulton County. I mean, which is honestly just the most surreal thing that the entire world, as you said, has been taking part in. I mean, I saw cover front pages, not just from the AJC, with including the mugshot or the Washington Post, but from around the world. I mean, there were people
all around the world. And you could argue, the purpose of a mugshot, as Shondell has pointed out, the purpose of a mugshot is so that in a trial you can identify a person. When you are looking for a person, you're talking to witnesses, you can identify the person. And there's a lot of people that kind of look like each other, okay? And so mugshots are so that you can differentiate people. There isn't a person under a rock anywhere in the world that doesn't know what Donald Trump looks like. It did seem like a bit of overkill to me.
Yeah, I think that the Fulton County sheriff made clear that Trump is not going to be treated any differently than anyone else in the Fulton County justice system. However, as you said, Trump is not like anyone else. He is the former president of the United States, who before that was a massive media celebrity. So this is just a completely surreal situation where you're applying, like the normal Georgia laws and normal county procedures to a man who is, larger than life in so many ways. So I think that this is really just another example of, the reality distortion field of Donald Trump just coming into contact with, our normal mortal institutions and seeing which one's going to cave first.
It also kind of killed the discussion of the debate on Wednesday night, and that's going to play into something at some point in time. But what are you looking for now? We've gotten to this moment. We've crossed over the Rubicon. Now we've got motions about trials and all this kind of stuff. What are you following right now?
I'm especially interested in if the different interests of all of the co-defendants in the Fulton County case are actually going to end up aligning here. I mean, we've already seen, Sean Still and, Trevion Cucci, there's a lot of, Jenna Ellis has been tweeting, sometimes in alignment with Trump's interests, sometimes in difference with Trump's interests. It's just going to be very interesting to see if all these 19 people are going to start rowing in the same direction on this case and become in agreement in opposition to Fani in terms of when these trial dates are going to be set, what the general arguments are going to be presented in court, or if you're going to start seeing a splintering of that group. I think that's going to be really the most important thing, because especially from a political perspective, that might influence when you start having these trial dates and you start having these hearings, which then could obviously run into the primary schedule, the general election schedule.
So Shondell Summers here with me today, and of course she has a lot of experience related to the legal system. And of course, right before the former president presented himself, it was announced that his main representation was changed to an Atlanta-based attorney. Now, there's been some talk about a bunch of his own attorneys have been charged, so you can't use those. And then he's got a lot of people. He's got a very, let's say, mobile legal team, because he's hard to work for, number one. He doesn't listen, number two. But also, there are situations where they can't work for him. He now has an Atlanta attorney. Do you know anything about this attorney? And
funny
will that
ask.
And will that push out anything? Because it seems like that's a legitimate thing to say, hey, I've just gotten a new attorney. I need time.
Well, Steve Sadow is his new attorney. His previous attorney was Drew Findling, who's also an Atlanta-based attorney. But Steve Sadow and I go way back. In fact, he and Dan are from the same hometown. So when Dan moved down here, he was already here, and we're social friends. We're professional friends. I've worked on cases with him. So in fact, I ran into him at a party last week on Thursday, and we were talking about the case, and I was kind of getting vibes that maybe he was going to be getting involved, but of course he couldn't talk about it. So it didn't really come as a great shock to me. And the thing about Steve is he's known for being the head of the ticket when it comes to the lawyers involved in any large defendant case. He did the Gold Club case, if you remember that from years ago, and he represented the main owner of the Gold Club. And he basically was sort of keeping everybody on the same track, and was, I think, probably disappointed when lawyers went their own way. So I think you'll see him kind of trying to rein in all the other lawyers and saying, hey, look, all for one, one for all here. But already you've got Cheeseborough filing the speedy trial demand. And like I said, what that means is his case is going to be severed off. He's going to go first. And if he goes first, that possibly could take the wind out of her sails on all those other people, because if you lose one, that's going to be the headline. If he gets convicted, that might mean all those other people, especially if he gets time. If he gets convicted, that might mean all those other people start running for cover and making deals with the DA for their testimony.
What you're saying fits into what Matt was just saying about people want to know where all this is going to go. Is it going to be people independently working on things, or is there going to be a clear consensus on this? Matt Brown from the Washington Post, thank you so much for being with us today.
Thank you.
To hear the full versions of last week's Martha Zoller shows, go to the podcast page at accesswdun.com, and you can follow me on social media at Martha Zoller.